we'll be going to the market to find out about the sales of sanitizers and how come people are fighting over it. We'll also find out from slum dwellers how they're coping in these times. And then we'll go to Parliament, which is racing to back President Akufo-Addo's directives with legislation. We'll also take you to Kumasi. But in the meantime, the Pharmaceutical Society of Ghana says it is working around the clock to supply essential medicines that are needed for the treatment of COVID-19. A member of the Public Health and Communications Committee of the Society has disclosed that the country does not have all the medication recommended by the WHO. Speaking at a stakeholders meeting under the auspices of the Ministry of Information, Dr. Mark Jadosi assured measures have been put in place to address that situation.
We have put together already protocols and SOPs for our members. We've put together handouts and communication material for the general public. We've acted a few videos that have started, have actually gone into circulation. And the big one is we're working with Pharma Ghana. We've reviewed the treatment protocols and everything else. And we've looked at the medicines that are key in the management, because a lot of the protocols that have come from WHO and the CDC and so forth, some of the medicines actually are not in Ghana. And we have to take measures to quickly bring them in to make sure that if we have active or any confirmed cases and they require intensive care and other things, we'll be able to properly manage them in Ghana. So that is what we have so far.
Dr. Mark Jadosi there. In the meantime, Information Minister Kojo Oppong-Nkrumah has condemned the sharp rise in the prices of sanitary products. He spoke at the same event.
I'd like to appeal to people who sell various products that can help in this cause. This is not the time to be unduly profiteering with your products and your services. Like the President said yesterday, these are not ordinary times. These are the times when we have to come together as a human species and ensure that we do things that assure the survival of each and every one of us.
Minister for Information Kojo Oppong-Nkrumah there. JoyNews, though, is learning that there is a mad rush for hand sanitizers in the Central Business District of Accra. Take a look. Well, that's the mad rush for hand sanitizers there in the Central Business District. I'm going to bring you back to the studio. In the meantime, I want you to share your thoughts with me on 0540109009. How are you coping? What do you see around you? Do you have any questions? I have here in the studio Dr. Emanuela Abassah-Konadu. She's a pharmacist, and her area is infection spread prevention. She'll help us with some answers. So if you have the question, drop it. Let's see how she'll be able to address that. Doc, you're welcome.
Hi, thank you.
Thank you so much for your time this afternoon. I just want to quickly find out how this whole coronavirus thing is playing out within your circles. I mean, how are people with like you taking it?
You mean health professionals?
Health professionals, I should say.
Well, we are the ones who are most exposed to it. So I want to believe that a lot of health professionals are a bit scared. But we are in to help. So for how it is, I'm not sure if I get your question, how it is.
I just want to find out how it's, I mean, what sort of conversations are you guys having? I mean, because you've said that you are at the front line. So exactly, so we get that. I'm going to take, that's not really the focus of my conversation. I'm just starting that to bring you in, because this is also about you, those of you who are offering help at the front line. How is it panning out? What kind of conversations are you having?
Okay, so I think at the moment, the most pressing thing is getting the medication that is needed to treat the coronavirus available in Ghana. Like we watched before, we have this drug called remdesivir that is being used currently, successfully in some cases, to manage the coronavirus. But we don't have it available here in Ghana. So right now, the pressing matter is getting these drugs available. And also this hand sanitizer issue is also something that is of concern, especially to us pharmacists, because we, being in the pharmacies, we see people come and complain to us about the pricing of the hand sanitizers and the unavailability of it, and trying to produce more hand sanitizers for people. So I think that is the thing that is on our mind most at
That's
the
the
moment.
thing also on our minds. Because I was going to also ask you to comment on the video that you just saw. You certainly aren't surprised.
I'm not.
But it will certainly worry you how crowded this space is and just what is happening there in a time like this.
Well, that's the thing about the Ghanaian people. You tell them not to do something and they go ahead and do it. We have made it pretty clear about avoiding very public spaces. But then there's the need to also get these hand sanitizers. So it's a conflicting thing. But the problem is the availability of the hand sanitizers. And like I said, there are groups of pharmacists who are trying to even locally produce hand sanitizers so that people can have access to them. The problem is that even the raw materials for hand sanitizers are now very expensive. So even to produce the hand sanitizers and to make them affordable for people has become an issue.
Okay.
So you go to a shop today, it's of this price, the next day it has shot up.
Yeah.
And it's not necessarily because businessmen want to profit or pharmacists want to profit, but it's because the raw materials themselves have also shot up.
But then the ones that were already in stock shouldn't fall within that bracket.
Well, yes, I understand that. But in the health sector, pharmacies in particular, it's not just pharmacists who run the game. They are businessmen who seek to profit from things. When you talk about supply and demand, you know, they realize the demand is going up, and so they also want to profit from that. And you, the pharmacist, working for the businessman, even though you can tell him that this is unethical and you shouldn't do it, he says, no, the demand is there. So
let me just supply.
Yes.
But in cases like this, what do health professionals advise, say, state health authorities to do? Because this is a foreseeable consequence of coronavirus. You
know, in other countries, I can use the USA as an example, they are actually starting to arrest facilities that are overpricing these hand sanitizers. So I don't know, maybe the Ghanaian government can start to do that. But we need to go back to the root of it, that if I'm importing certain brand sanitizers and I'm getting it for a certain price, there's no way I can sell it for less. Even when you go online and you search for a brand of hand sanitizers, you find that the dollar price is very high. So bringing it down here to the Ghanaian market and then putting even just a little profit on it, you realize that the price is exorbitantly high. So I think that what the Ghanaian authorities need to do is to think about locally manufacturing the hand sanitizers. And I think that's a conversation that's already started. So hopefully very soon we can start that.
Yesterday we heard President Akufo-Addo say that, but we also heard that there are ways that you can produce it at home. You can produce your own hand sanitizer. Do you have an idea how to do that? If you can take us through?
You can. I don't know the exact quantities, but there's glycerin, there's ethanol, and then there is some preparations also have aloe vera. So you can just Google the WHO recipe for hand sanitizers.
Okay, so you can Google
yes.
WHO recipe for hand sanitizers.
Yes.
Okay, maybe we can try that on the show as well. WHO, so this is one of the things that you can do. WHO recipe, you say. Recipe for hand sanitizers. Okay, hand sanitizers. So if you're watching, you might want to give it a try. Google it. Let's see what you find. WHO recipe for hand sanitizers. There's also a video that's been going around on social media. I don't know if you've seen it. In that video, there's a woman who's talking about the things you need. She says you need a bit of alcohol, you need a bit like dry gin, you need a bit of aloe vera, and I think some jelly. She mentions well, I understand that we actually have a report. Let's take a look at that, and when we return, if there's any advice you can add on top of that, we'll take it. So take a look.
Sala demonstrates how she uses the abassah to disinfect her hands. She pours a bit of the quarter-filled 500ml bottle into her palms and rubs till it fades into her skin. She trusts that this procedure has killed any virus and is ready to serve her customers. The abassah serves the same purpose as the sanitizers for me. I am able to use it for a day or two, and it helps sanitize my hands while handling money and even shaking people as well. She's not the only one who has embraced this new style of protecting oneself from the spread of the coronavirus. Her colleagues have bought into the idea.
I use sanitizer and abassah. They say abassah. So this morning I use abassah and sanitizer to wash my hand because of the alcohol.
It used to be 2 cedis, but now it has become 8 cedis. And our alternative is to use the abassah. Even though their new style hasn't been proven scientifically, it's a better alternative to the now expensive hand sanitizers. The 2 cedi bottle now sells at 8 cedis, and the 5 cedi bottle now sells at 12 cedis. This trader is very unhappy about the situation.
How many people can afford it now, especially the poor? Imagine a family of 2 or 4 children. How will they manage? It's very disheartening.
But vendors have been justifying the prices. One of them who attempted to explain says they have no control over the situation.
Very early this morning, I had to go and restock, and the prices had ballooned. It is not my fault.
Meanwhile, abassah seller Auntie Lizzie is happy her abassah is moving. While there, she serves a customer.
The young men enjoy the abassah. They say it helps their health, and they also use it as a sanitizer.
On the other hand, other traders are ensuring consistent washing of their hands as a protective measure.
So that's a report that Mami Sinyamiche Thompson filed yesterday, and it has to do with the fact that people can't get sanitizers, and so they're using abassah. We'll talk about the recipe again, but I want you to tell me what your thoughts are. Abassah versus because they're saying that, well, if you say alcohol, we should use an alcohol-based sanitizer. Then why don't we just go to the alcohol?
Well,
directly?
there's a certain concentration of alcohol that you should use that can kill the virus.
Okay.
So the abassah on the market is roughly between 40% to 50% of alcohol. That's not enough to kill the virus.
So you can still be using abassah, but the virus
and still there will be no effect.
Does it mean? Please go ahead.
So the most appropriate percentage of alcohol to use for sanitizing your hands is about 70%. Between 65 and 70%, you are assured that it's going to work. So the abassah that they are using, the vodka people, it's not going to do.
It's not going to. So does that mean that the combination of the alcohol, the glycerin, and all of those things now come together to form a certain amount of alcohol concentration that is then able to kill the virus?
No. The glycerin and those things don't necessarily affect the concentration of the alcohol.
Okay.
The alcohol is on its own. But what it does is that it prevents drying of the alcohol. Alcohol evaporates very quickly and can be a bit harsh on the skin. So we have the glycerin, which acts like an emollient, and emollient is just to soothe the skin so that it's not so burning. And then just to give it a base that you can apply. Ideally, you shouldn't be applying alcohol directly on your skin as a hand washing. No, you shouldn't.
Why not?
Because it can affect your skin cells.
Okay.
It can damage them, especially at very high concentrations. So ideally, there should be some kind of base that will protect your skin from drying. It can easily dry up your skin.
Okay, let's go on and talk about wrap it up. The conversation we started about homemade sanitizers. I don't know if we found anything when we Googled the WHO recipe for hand sanitizers, but give us an idea what you think we can do if we have to make this
so I have
at home.
I have the recipe here.
Okay.
It says 96% of ethanol, 3% of hydrogen peroxide, 98% of glycerol, and then sterile or distilled water. Now these things I don't think they can be made at home.
They can't be made at home.
No.
So the video,
but our local industries can go into making more of these, because to be honest, I don't know how many lay people know how much alcohol is in 96%. I don't know how many of them can prepare accurately 96% of ethanol. How many people can measure 98% of glycerol? You know, so all of these things, you need somebody with some kind of chemistry background to be able to prepare them. So as for the handmade sanitizers, I have read on them and I don't see any evidence to support their effectiveness, actually. I went online today, read about a couple of them, and most people were saying that they don't really think that the hand sanitizers, most studies were saying that the homemade hand sanitizers may not be as effective as the commercially produced one, especially because we've not even carried out any studies to prove that they can actually kill the coronavirus.
Yeah. Well, let's see. I do have some questions here. I'm going to take you through them. But before that, one of the main parts of our conversation is to look at your area, infection spread control. What sort of advice do you have? How can we control the spread of coronavirus in these times in the country, considering the strength of our health systems as compared with other countries that we've seen deal with it? China, the United States, Italy. You know our system very well. What do you see and what can you say regarding our ability and how we can control the spread of coronavirus? So
I think the most important thing is taking preventive measures. So we have a variety of things. You need to thoroughly wash your hands for at least 20 seconds under running water. Let's not do the bowl type of hand washing, no. We need running water. You need to keep about, at most, or at least 3 feet from someone that has some symptoms that you suspect, you know. And in fact, you should avoid as much as you can these social gatherings. I know a lot of us like to party and things, but a lot of these clubs are even shutting down and churches are also closing, so that's a good thing. But as much as possible, you should just try and self-quarantine. Just try and stay at home, especially if you start to experience certain symptoms that you think are related to the coronavirus. So I think that's about it. The hand washing, still don't really know alcohol-based sanitizers.
But we still don't really know if there have been any community
transmission in Ghana. Not yet, but we are still taking preventive actions. Yes, we can't just sleep because there hasn't been.
Let me read some of the messages I have now. This one said, is it advisable to buy online from China? I'm asking because I bought an item from Kiku and the item was sent to me, but I don't know whether to go for it or not.
So the virus does not last that long on surfaces. studies have shown that at most 24 hours the virus will die.
Okay.
So, and for a parcel to come from China to Ghana, it's going to take weeks. So by the time it gets to our country, there is no evidence that there would be any kind of virus on it. So I think it's safe to have your items.
I have more questions, but